Ever wondered why your teeth feel that sharp sting with your morning coffee or ice cream? That, my friends, is the dreaded tooth sensitivity. And you know what? You're not alone. Millions of people experience this sharp, sudden pain in their teeth, making everyday activities like eating and drinking a real pain. Literally. But hey, don't despair. In this video, we're going to break down the common causes of tooth sensitivity and, more importantly, what you can do to find relief.
One of the most common culprits behind sensitive teeth is gum recession. You see, our gums act like a protective blanket over the roots of our teeth. But when the gums recede, which can happen due to things like aggressive brushing or gum disease, those sensitive roots become exposed. Imagine it like this. You wouldn't want to walk around without skin, right? Well, the roots of your teeth feel the same way. When those roots are exposed to hot, cold, or even sugary foods, bam, sensitivity strikes.
We've all heard of cavities, those tiny holes that can wreak havoc on our teeth. But did you know that cavities can also be a major player in tooth sensitivity? Now, cavities form when the enamel, the hard outer layer of our teeth, gets eaten away by acids produced by bacteria in our mouths. Think of enamel like a shield protecting your teeth. When that shield weakens, your teeth become more vulnerable to sensitivity triggers. So if you're experiencing tooth sensitivity, it's crucial to rule out cavities with a visit to your friendly neighborhood dentist.
Just like our bodies, our teeth experience wear and tear over time. Years of chewing, grinding, and even brushing can take a toll on our enamel, making our teeth more susceptible to sensitivity. Imagine using a scouring pad on a delicate surface every single day. That's rough. Similarly, using a hard bristled toothbrush or grinding your teeth can wear down the enamel, exposing the sensitive dentin underneath. So, be kind to your pearly whites. Switch to a soft bristled toothbrush, and if you grind your teeth, talk to your dentist about getting a mouth guard.
Remember how we talked about gums receding and exposing those sensitive roots? Well, inflamed gums, also known as gingivitis, can also be a major contributor to tooth sensitivity. When plaque, that sticky film of bacteria, builds up on our teeth, it irritates our gums, causing them to become red, swollen, and yes, even sensitive. Think of it like a tiny army of bacteria waging war on your gums. And just like any good army, they can cause some serious damage. So if you notice your gums are looking a little worse for wear, don't ignore the signs.
Now, things get a little more serious when we talk about pulpitis. Pulpitis is an inflammation of the pulp, the innermost part of our teeth that contains nerves and blood vessels. Remember those sensitive roots we talked about? Well, the pulp is like the control center for those nerves. When the pulp becomes inflamed due to things like deep cavities or trauma, it can cause intense and persistent tooth sensitivity. This is not something you want to ignore. If you suspect you might have pulpitis, see your dentist ASAP.
Periodontitis is a serious gum infection that damages the soft tissues and bones that support our teeth. Remember those protective blankets we talked about earlier? Well, periodontitis is like someone taking a pair of scissors to those blankets, leaving your teeth vulnerable and, you guessed it, sensitive. This condition requires prompt treatment from a dental professional to prevent further damage, which can include tooth loss. So if you notice any signs of periodontitis, such as loose teeth, receding gums, or persistent bad breath, don't wait to see your dentist.
So there you have it, the most common causes of that annoying, sometimes debilitating tooth sensitivity. The key takeaway here is that identifying the root cause of your sensitivity is crucial for finding the right solution. While some home remedies can help manage symptoms, it's essential to consult with your dentist for a proper diagnosis and personalized treatment plan. With the right approach, you can overcome tooth sensitivity and enjoy your favorite foods and drinks without that dreaded twinge of pain. Thanks for watching and see you next time.